Muscat is rapidly expanding, and its healthcare infrastructure is racing to keep up with the sprawling urban footprint. But in a city this size, simply choosing the clinic closest to your home often means overlooking the specific expertise required for your treatment. Dental care here operates differently. Instead of uniform clinics scattered randomly, the city has developed decentralized, specialized neighborhood hubs geared towards specific demographics. This means a world-class center equipped for complex surgeries might be poorly suited for a patient who just needs a routine filling. To navigate this system, we have to look at 4 distinct patient profiles: the aesthetic optimizer, the pragmatic patient, the family planner, and the structural investor. We will map these geographical specialties to show the exact trade-offs between luxury and essential care, and provide a vetting protocol to protect your wallet. Getting the best clinical and financial outcome requires treating Muscat's dental clinics like highly specialized boutiques rather than neighborhood convenience stores. For adult patients, the primary decision comes down to budget and priority, paying a premium for cosmetic perfection or minimizing costs to restore function. If you are an aesthetic optimizer, your hub is Mouj. This district caters to residents and professionals looking for high-end cosmetic dentistry. The clinics here focus on signature treatments, digital smile design, e.max ceramic veneers, and painless laser whitening. They also utilize 3D intraoral scanners, which entirely replace the discomfort of traditional impression molds. The trade-off is financial. You receive a high level of comfort and precise aesthetic control, but at costs that standard insurance networks rarely cover. Compare that to Ruwi. This is where Muscat's commercial density and diverse workforce have created a center for fast, practical healthcare. The focus in this district is strictly utilitarian. Clinics are equipped for rapid pain relief, deep root canals, standard tooth extractions, and managing acute emergencies. These environments bypass luxury technology in favor of broad insurance acceptance and durable, economical materials like amalgam, keeping prices competitive. Neither district is objectively better. The right choice depends on whether you are buying visual symmetry and social prestige or simply buying an exit from physical pain. Patients with needs that fall outside the luxury budget binary must seek out specific environmental hubs based on their stage of life. El Coram is engineered for the family planner. It serves as the primary hub for pediatric dentistry and fear-free child behavior management. Parents often commute past closer general practices to reach El Coram, securing preventive care and a psychologically safe space for their kids. Similarly, Al Khawair captures the teen demographic seeking orthodontics and Invisalign, while Seeb handles multi-generational families requiring continuous prosthodontic care and dentures. The highest stakes belong to the structural investor. For these patients, the adjacent districts of Azaiba and Gubra function as advanced surgical hubs. These clinics focus on permanent titanium dental implants and advanced bone grafting. Patients entering this hub must commit to higher upfront costs and long-term surgical timelines. In exchange, they achieve permanent restoration of their chewing power and bone health. For complex surgeries or delicate pediatric cases, traveling to the specifically engineered district is the only reliable way to mitigate the risk of treatment failure. But selecting the correct neighborhood is only the first step. You still have to vet the specific clinic before starting any treatment. This diagram outlines the 3-pillar clinic vetting protocol. First, verify the dentist holds an official Ministry of Health license. Second, demand proof of Class B autoclaves and strict infection protocols. Third, confirm direct insurance tie-ups and require itemized cost estimates. Skipping this protocol, even in the most luxurious areas of Muscat, leaves you exposed to cross-infection, predatory billing, and medical malpractice. Now we map your specific scenario to the city grid. This decision tree starts with one foundational question: what is your primary clinical need and your available budget? If you want cosmetic treatments and have a high out-of-pocket budget, you follow the path to Mouj. If you have an emergency, need basic fillings, and are prioritizing insurance coverage, you head to Ruwi. Direct your pediatric needs to Al Kurum and send your surgical implant investments to Azaiba or Gubra. This geographic logic also applies to the influx of international medical tourists visiting Muscat, allowing them to locate care near their specific accommodations. Review your insurance, confirm your budget, and use these neighborhood hubs to book the exact specialist you need. Long-term dental health comes down to a single decision: matching your clinical needs to the neighborhood hub designed to treat them.